How are you doing? Today we're going to talk about a lumbar herniation. My name is Dr. Shah. This is an individual that has a herniation at the L3-4 level. He has pain in his lower back as well as down his legs, more so in the thigh and the knee. He says most of his symptoms are on the right side. He's tried all the conservative therapy, NSAIDs, which are non-steroidal anti-inflammatory drugs such as Motrin, Aleve, ibuprofen. He's also tried physical therapy. Has not provided him with any relief. No particular event that kind of led to this, but he's got a lot of pain. He opted, instead of normal epidural steroid injections, he opted for a regenerative therapy. And what I mean by that is he wanted stem cells placed in his disc as well as in his spine to see if we could alleviate a lot of the symptoms. So let's go over the MRI and I'll show you exactly what we did to treat his pain. This is the MRI. When you look at it from a lateral projection, meaning looking at the spine from the side, what you see is the spinal cord. That's this dark gray thing coming down right here. And on the side, on either side, you can see the cerebrospinal fluid. You want this much space in the spine. By having this space, the spinal cord is able to dance freely in the spine, and you're able to perform all your normal activities without experiencing any discomfort. Now, as we go down, I'm going to use the pointer on this side. As we go down, you can see that there's a big herniation over here at the L3-4 level, and that's pressing the spinal cord. It's pressing the spinal cord right here. We're looking at the image from the side. Now we're going to take a cross section of this image. So I'm going to pan over to this side over here, and you can see on this image how normally you'd have a spinal cord, a nice open circle over here. These little gray areas are the roots, the nerve roots, and you have a lot of cerebrospinal fluid here. This is what you want on a normal MRI. As we kind of go down towards the level of the herniation, you can see that the herniation is beginning to appear here. It's beginning to compress the spinal cord. We'll go down a little further. You can see this herniation is really obliterating the spinal cord, touching the spinal nerve roots, causing irritation of the nerves, affecting the nerve as it exits the spine as well. So this is why he has a lot of pain in his lower back as well as going down, more so on the right leg. MRIs, when you look at the MRIs, left side is right, right side is left. It's the opposite because we're looking at the patient from the bottom. These things over here, these are called facet joints. The facet joints in this case are a little arthritic as well, so we want to treat that. Now, another thing that we notice when we're looking at the MRI, we don't just look at the herniation, but we look at the muscles. These are the muscles in the back, right in the back of the spine. These are called the multifidus muscles on both sides. There's a little bit of this white streaking that we see. That's some fatty infiltration. Everyone has a little bit of this, but the more you have of that, the more back pain you can have, and that results from nerves being compressed. So now this is the level above the spine. Now as we go down after the level of the herniation, you can see the amount of fatty infiltration increases. So this can also cause a lot of low back pain symptoms. So we want to treat that as well. And you can see as we're going further down, there's even more fat in the multifidus muscles. You can see that as we go down. So we'll treat that. We're going to treat that with platelets. What the platelets do is we inject the platelets into the multifidus muscles, and they'll kind of reinvigorate the musculature. The patient will work out. He'll start feeling better. Probably in about 6 to 8 weeks, he'll notice a little decrease in his low back pain. Now, another area that we're going to look at are the facet joints. Those are the joints over here. A little bit of arthritis over here. A little bit of arthritis at the L4-5 level, so we'll capture those. A little bit of arthritis over here at the L5S1 level, so we're going to capture that level as well. Now, another thing that we notice when we look at the MRI on lateral projection is we see that this disc right here, this is the L5S1 disc, is also a little degenerated. We want our disc to be nice and plump, like this disc over here, where you have a little bit of water. We call that hydration within the disc. These are nice plump discs. Everyone does well when you have nice plump discs. When they lose water, over time, you can see how this one's losing water, they become thinner because they become dehydrated. You tend to get some herniations as a result of that. And over here, this has already gone through that process. And you can see as you lose a lot more of this material, this bone over here is kind of starting to change some colors. It's because this bone is kind of communicating with this bone, kind of two bones, one on top of the other, also causing maybe a little bit of discomfort for the patient.